I've often sat here and said physician associates are not doctors. However, I know politicians make decisions in their best interest, and though one might benefit is despite not being for you. We were introduced into the UK about 20 years ago because there is a shortage of doctors. No news here. However, with these little videos the man has been doing, having seen a few NHS workforce plans here and there, I have no doubt in my mind that the medical profession has been eroded and that we physician associates are the last piece. Before you jump through the screen and choke me, hear me out. My first suspicion came from the Cambridge Report of 1968 and the Crown Report of 1999, which were the cornerstones for the current non-medical prescribing we have today. When these changes were introduced, the proponents of it argued that the medical landscape was changing. This would allow other healthcare professionals seeing patients to better serve them without necessarily needing the doctor. Obviously, there is nothing wrong with it as a standalone event. However, if you put it in the context where the Department of Health back in 2000 made an explicit declaration to flatten the medical hierarchy and shatter the traditional demarcations, one can justifiably ask a few questions. It is quite obvious that I'm not a doctor, I'm a physician associate. So why should I care if there is something that could benefit us and not necessarily benefit the doctors? This is because I believe the best slave is the one who is under the impression that they are actually free when they are not. I'm 100% certain that every physician associate sets out in the morning when they go to their various jobs, their various specialties, to do the best they can for their patients. I have no doubt about this. However, sometimes I question myself, despite this sincere desire, could we still be doing harm by the simple fact of not being doctors? With all that is going on, there has to be days where you look yourself in the mirror and you ask yourself some questions. There is a reason why medicine was 6 years, became 5 years, and now with plans to make it 4 years with a new workforce plan. It's under consideration, nothing has been confirmed. That also raises a dilemma that I'll highlight in a second. As a physician associate student, I attended all my lectures, went to all my placements, though sometimes occasional, on the rare occasion with the appropriate shimmy I might have left earlier. But I've been filled with dread more time than I can remember during my usual nocturnal escapades with Kuma and Clark. There are things in that book that sometimes make me wonder what game we are playing as physician associates. I do not know if our bros from another mother know these things when they graduate or they come to know them with time and experience, but if they do, a simple question must be asked: why this carelessness? One might want to attribute this to the imposter syndrome, but this is not it. There is something tangible to this feeling. I'm not speaking about the weird and wonderful conditions one might be excused for not knowing. The presentation might just be a cough, a dizziness, a heartburn, but you have absolutely no clue about the underlying condition causing those symptoms. Do you know why? Because nobody taught you. You don't even know they exist for you to consider. You will see symptoms that have no apparent relation with each other. You'll want to treat A, see how A goes, you want to treat B. The actual thing underlying the disease, you have no idea what it is. But when you see them laid in black and white and their connections highlighted, a shiver down your spine is the minimum proof of your humanity. And certainly, all things being considered, simpler explanations often do suffice. And yes, our bros do not know everything. But to what extent? I do not know. You do not know, for the simple reason we have not walked that path. Though we haven't, we can justifiably say we are not the same. And if we are not the same, why am I allowed straight out of PA school to go work in the GP, to go work in a hospital in a certain specialty? Of course, one could make the argument this is due to the delegation clause, supervision, X, Y, and Z. But the same thing could be applied to a newly qualified medical students. They are not allowed. They cannot even do their FY1, FY2 and say I'm come to do the same work the PA is doing with the knowledge they have acquired at that point. They are not deemed qualified enough to sit there. So what makes you and I special? What do we know that they don't? The answer is nothing. There is an obvious fallacy here, a sort of cognitive dissonance. You cannot justify the one without questioning the other. Something is just not adding up. It should come as no surprise that some doctors are vehemently in opposition to the whole physician associate enterprise. To them, we should not exist. Point blank. And there are other doctors who are also very supportive of the rule. I sometimes wonder how practitioners knowledgeable of medicine and its associated risk in practice can have such diametrically opposed positions. They all went to medical school, They've all gone through their various training. They've all gone through their various specialties. So how can one doctor see this glaring danger and another doctor say, no, it's not dangerous? I say this because it was a medical school that taught me how to become a physician associate, and I was taught by doctors. My placements, I did them with doctors. The confidence physician associates have in themselves, in their ability to practice the medicine we practice within that limited scope, is because we were taught by doctors. Those same doctors that teach medical students and train them to become future doctors, they do those lessons and then come to us and teach us to become physician associates. If there was something inherently wrong, inherently amiss in the training of physician associates, dangerous in that sense, it is that same individual. So what do these tutors know, or the other people opposing the profession do not know? Would they be comfortable if a physician associate like myself or my colleagues treated them in primary care, in the hospital setting? There's a saying that if you really want to know what a man thinks about you, ask to marry his daughter. He will dispose of any niceties and point out all your flaws. From the last hair follicle to the nails of your feet, he will describe you and point out everything, because he has a skin in the game. So the people teaching us, if we are not what some of your colleagues deem us to be, there's inherent danger, working liability in hospitals, would you allow a physician associate to treat you? If not, why? Why did you guys not say anything? It has been 20 years since we've been around. 20 years. Everywhere you turn your head, there's a physician associate in the news somewhere. People lambasting the profession left, right, and center. One would have thought the first cohort would have been the pioneers. By now, everything would have been ironed out, would have been smooth sailing. You know where you are, where you fit into the team, and you do your job. But no, 2023, 20 years after the whole thing, we are getting the smoke. Come on, guys.